Please unmute.
Still on mute.
I'd like to call this meeting to order. Please rise for a moment of silence for our pledge of allegiance and a moment of silence in the private prayer. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have roll call, please.
Commissioner Robbins,
Here.
Commissioner Rushton,
Present.
Chairman Bonnet,
Here.
Commissioner Wessel,
Here.
Commissioner Sizzle,
Here.
Commissioner Alguier,
Here.
Commissioner Lautner,
Present.
all present.
Thank you. Then that brings us to approval of board minutes. The only one I have here is for the special session from April 12th, 2022.
Mr. Chairman,
Yes.
I would move to approve the special session meeting minutes of April 12th, 2022 as presented.
Or all those in favor say aye.
Aye.
All those opposed, no. Motion passes 7-0. Thank you. Now we have the approval of the agenda. We do have one late addition. It's 13B. I don't have any other changes. Commissioner West.
Move to approve the agenda as presented and amended.
Second.
All those in favor say aye.
Aye.
All those opposed, no. Motion passes 7-0. Thank you. And that brings us to public comment. Please come forward. Public comment.
Bill Wiesner, Elmwood Township. Want to speak again on the election 2020. I believe that we should replace the Dominion voting machines with paper ballots that are local, secure, and easily auditable. And actually, just before the meeting, doesn't mind, but John, I was talking to him, and he said, well, if the machines are stealing the votes, they probably stole mine, because I only lost by a couple hundred votes. And I made the point, though, yes, paper ballots would be better for every and anybody, all men, women, and children in Leelanau County. Because instead of going inside of a machine, I mean, even Michelle or anyone hasn't been inside those machines. What happens? So it would be better for everybody. It's not just one side against the other. So, and what I'm starting again with Tina Peters, that's who I ended with last time. And there's the link on the top left, just under her picture, to all three of the investigations. They're very detailed by these experts who have 120 years of experience between the three of them. But instead, I just copied this one World Tribune article, which kind of summarizes what happened inside the machines, especially the last one. So it says, on forensic analysis, the drive image of the Mesa County's Dominion voting machine election management system saw unauthorized and illegal, I'm looking at the highlighted stuff, unauthorized and illegal manipulation of the tabulated vote data during the 2020 election and the 2021 Grand Junction municipal election. And some people have brought up the fact that in Antrim County, you know, how many votes were swung? It was a tremendous amount. And they said, oh, that was just the air within the building. Well, this air, which, by the way, no one could recognize, none of the clerks did, none of the workers, They worked hard, they followed their protocols, but yet it happened. They've got the evidence. So in Antrim County, it was just human error. But here it's saying it happened in 2 elections, twice. It didn't just happen once. So human error, would you say it because it happened twice, it was human error, the same human error? I guess you can go through, I at least skim through the highlighted areas. I want to get to the back though. But before I do, the bottom of the right column there, I'll just read through that highlighted stuff. The manipulation would not be identifiable to an election official like the clerk or anyone using the voting systems, nor to an observer or judge overseeing the election conduct, much less to citizens with no access to voting machines. Without both cyber and database management systems expertise and unfettered access to database records and computer log files, many of these were destroyed by the actions of the Secretary of State from the EMS server. The manipulation is undetectable. So files were destroyed. That to me, and if that happened in Leelanau County, and we don't know because we haven't been inside the machines, but if it happened here, to me, Dominion, I'm sorry. We can't count on this being fair. On the back side, I just mentioned, I agree with both John and Gwen, Commissioner Alger, that the people here, I don't believe there was anything that they did wrong, but it's inside the machines. And then I just summarized again what I put at the end of last week's. That's kind of the 3 studies, the main overview of each of those 3 studies. And then you see Queen Esther there. Okay, what's happened so far? Everything's above board as far as our county, but if the machines are still flipping the votes, what are the people in charge, say commissioners or clerks especially, not just the one here for the county, but the other 11 precincts and Northport and Empire? What do? They should be more concerned than me. They represent a lot of people. So what do they do with this information? And it could be a Queen Esther moment where she says, for such a time of this, I'm going to do something. And then the last thing, I just ran out of time, but you got to read this Matt DePerno stuff. And there's a link to all of it too. Thank you very much.
Thank you. Any other public comment?
Good evening, commissioners. My name is John Fletcher. I live in Lake Leelanau. The purpose of my comments this evening are to address the pressing need for certain commissioners to recognize that they represent all the people of Leelanau County and not their self-serving agendas. Their lack of respect, self-respect, and integrity are at the very heart of this issue. Respect, also called esteem, is a positive feeling or action shown towards someone or something considered important or held in high esteem or regard. It conveys a sense of admiration for good or valuable qualities. It is also the process of honoring someone by exhibiting care, concern, or consideration for their needs or feelings. Some people may earn the respect of individuals by assisting others or playing important social roles. Individuals are considered to be worthy of respect until they prove otherwise. Integrity. Integrity is the practice of being honest, showing a consistent and uncompromising adherence to strong moral and ethical principles and values. In ethics, integrity is regarded as the honesty and truthfulness or accuracy of one's actions. Certain commissioners, again, continue to pursue their political agendas, unfounded opinions, and biases during BOC meetings. Here are some examples: promoting prayer, failing to wear masks, assaulting Lisa Peacock, promoting the Great Barrington Declaration, taking the people's vote away, early childhood, failing to take action on septic tank inspection, a very old issue, failing to adequately respect the Grand Traverse Band of Ottawa and Chippewa Indians and its contributions. All commissioners, as our representatives, have a responsibility to conduct business based on proposals and initiatives supported by science, facts, and data, which address the needs, health, and safety of the county and its people. Thank you.
Thank you. Any other public comment?
Rick Robbins, Elmwood Township. I don't know if any of you've heard, but last night or this morning, about 2 a.m., we lost a pioneer of our community. Bruce Price passed away. So I got something I want to say to y'all for Bruce. From a friend to a friend, for a friend. When I die, if you need to weep, cry for your brother and sister or sister. Walk in the streets beside you. And when you need me, put your arms around anyone and give them what you need to give me. I want you to leave something better for words and sound. Look for me in the people I've known or loved. And if you cannot give me away, at least let me live in your eyes and not in your mind. You can love most by letting hands touch hands, by letting bodies touch bodies, and by letting go of the children that need to be free. Love doesn't die, people do. So when all what's left of me is love, give me away. Rest in peace, my friend Bruce Price. You'll be missed.
Thank you. Any other public comment? Seeing none, we'll come to commissioner comments.
I would just like to say that we will really miss Bruce's public comments.
Thank you. We'll move on to communications, proclamations, and presentations. And we have our Benzene Leelanau Health Department here. Welcome.
Thank you. Good evening, everyone. Nice to see you all in person. I'm Lisa Peacock. I'm the health officer for the Benzene Leelanau District Health Department. And I think Laurel's going to pull up some slides for me. She's somewhere.
No,
where she
she's
can
good.
hear
Yeah,
me.
she's-
Okay. Okay,
I
wonderful.
think we all have it anyway.
Yeah, that's what people know.
Yeah, what I sent to you was our 2020 annual report. This meeting always falls in between the printing of our annual reports. And so soon, probably in early June, our 2021 annual report will be ready. So it's never quite at the same time that this is scheduled. So I sent you the 2020 annual report in electronic format. If anybody would like a copy printed, we'd be happy to do that for you. But tonight I'm going to talk about the 2021 year, because last year when I was here at this time, we talked about 2020. So just a few things that I'd like to highlight. And Laurel, if you can go to the next slide, that'd be great. Our vision statement was rewritten last year when we were in the process of updating our strategic plan. And this vision statement was contributed to by all of our staff and Board of Health members as well. And I'll just read it to you. Optimal community health and well-being supported by equitable services, outreach, and education delivered by expert, caring, and compassionate, trusted public health professionals. So that's the vision that we hope to achieve in the long run. That's what we'd like to see for the people of Benzene and Leelanau counties. You can go to the next slide. As part of our strategic planning process, we also work on a practical vision. These are more kind of concrete steps that help us achieve that vision. And so as you read that list, you'll see that it's focused on things like outreach and communication with the community. We've made a lot of progress in our outreach to the community throughout the COVID pandemic, and we continue to build on the skills that we've learned and the resources that we've been able to bring in. Some of the focus of our practical vision has been on our internal capacity, both in support of staff, improved technology, improved finances. We've really been able to secure some additional financing throughout the pandemic through billing for the COVID vaccination administration fees, grants that we were able to get to support the work that we needed to do. And that's allowed us to really kind of set a good plan for the future. Our overall focus of both our vision and our practical vision continues to be on health equity and ensuring that everyone in Benzene and Leelanau County has the opportunity to achieve good health and overcome whatever barriers they may have to that. So the next slide, I'm just going to go through our three divisions and talk about their accomplishments over the year. In 2020, what I think about when I think about our administrative services division, led by who's here with me tonight, is talent and growth. She is so talented and has been leading our, the administrative part of our health department and our whole health department for a very long time. Something that is really significant for Dodie this year was she was able to add extra staffing to her division. When the agency grows and we get grants and funding to do programs or deliver services to people, sometimes we can forget about the backbone of the organization. And what happens is then they really just crumble under the work that they have to do to keep up with everything else. So Dodie was able to add some key staff this year, including a biller and an additional accountant. So we're really thrilled about that. And I know she's thrilled about that. We were able to do something that had been left alone for a long time at the end of 2020 and the beginning of 2021 with the help of our Board of Health, and that was to revamp our compensation and classification schedule. That is a really important part of our structure. It is something that needs to be approved by the Board of Health, where all of our jobs fall into a certain classification. They're scored according to a standard set of criteria. It's a really objective process. And then they're given a points value based on that scoring, which determines the level of pay that each of those positions falls into. That hadn't been touched in 20 years. And so we had positions we no longer had anymore. We had new positions that were being added. And some of our salaries were a little bit out of range, and we were having difficulty recruiting and retaining employees. And so in pulling all of that together and kind of level setting all of it, we really have been able to retain our staff throughout the pandemic and recruit new staff who have been just wonderful additions to our team. I just would say that we have such a highly qualified team right now. We should be really proud of how far we've come with that. And again, Dodie's team managing the growth in billing revenue and grant revenue this year. We just came away from our financial audit, was completely unmodified, the cleanest opinion, really no findings at all, and high compliments for how Dodie managed all of those different federal funds coming in, which was challenging for a lot of agencies. So then on to our environmental health division. Many thanks to Leelanau County for the work that you've done with us in digitizing those environmental health records. Thank you for your support. We really appreciate it. It really kicked it off for both Benzene and Leelanau counties. We're kind of 3/4 of the way through the process with Benzene County now too, and soon anyone who's looking for records from the environmental health department at the Benzene Leelanau District Health Department will be able to find them on their own from their own computer and not have to come in, or it saves a lot of staff time as well. So when I think about environmental health over 2021, I think about demand. They have met just a really high demand. Just from 2020 to 2021, the demand for our number of land use permits went up by 29%. And so that's a huge increase in volume, as well as, managing the pandemic. 2020 was, incredibly busy, even though for much of that time, construction was closed down and, the economy was limited. So we're really happy that they have been able to bounce back from that our economy has been able to bounce back from that, and that people are busy. And our land use staff is busy. We've also added some new staff, one person in terms of administrative support and then another sanitarian, which has been really helpful. Given that increased demand, our environmental health director, Eric, who you see frequently, does a great job of using data to determine how, what his level of staffing is and what he needs to meet the demand of the community. So again, thank you for your support. We'll go on to Personal Health Division. So certainly when I think about our personal health division, I think about unwavering community support. Managing the COVID pandemic fell into this division. Our public health nurses live and work in this division, and we couldn't have done it without the help of so many temporary staff and volunteers. So many people who had retired from the health department or had retired from some other sector of health came back and helped us, whether it was helping us with mailings, with scheduling, with sending out notices, with staffing clinics. We just had this greatly expanded team who came in and really helped us to serve the community. We gave over 24,000 doses of COVID vaccine in 2021. We did over 5,000 case investigations, and each of those case investigations also had several contacts associated with that case of COVID-19 that were contacted. Our team is still in place and serving the public in a different way, staffing our public health information line for people who still have questions. Cases are still reported to the health department, and when they are, we do contact them and make sure that they understand where they can get care, isolation and quarantine guidelines and things like that. They also help us with scheduling for vaccination clinics. We've had an uptick in the demand for vaccination recently with the additional booster that has been approved. And so, we just continue to shift as the demand from the community and the needs of the community shift. So in addition to that, we have also in the personal health division been growing our school-based services. Last year, before the beginning of the school year last year, we were able to partner with Health Department of Northwest Michigan to implement mental health services in Sutton's Bay schools. We were able to hire a mental health provider to serve those students, that student population. It went really well. That was a grant we would not have had access to if we hadn't had the partnership with Health Department of Northwest Michigan, because it was only available to entities who already had one of those grants, and they did. So we worked together to make that happen, and it's been great. We just recently submitted another similar grant for mental health and school nursing services in Benzene County. We have also received some funding throughout the year to have school nurses placed in our schools or serving our schools. They're sharing, we live in a smaller community. The student populations are smaller. And so we've been able to share those nurses across school districts. It was a great help to our schools throughout the winter and spring as they were dealing with contact tracing and isolation and quarantine and all of that stuff, testing protocols and things like that. We just recently found out that we'll have extended funding to continue those school nurses. So we're really excited that they're able to continue. And then the other thing I would say about personal health is just the improvements that we've been able to make in communications. Our social media exposure went from under 100 Facebook followers to over 3,000, in that short time. And so we have Rachel, who is our, public information officer, and does a really great job with the social media and getting information out to the public. So we're always looking for ways to improve. If you ever have suggestions, we're more than happy to hear them. The next slide. So that's really small and you probably can't read it, but what I will tell you is that list of bullets that I gave you under the practical vision has an entire list of actions that we'd like to take to achieve those practical ideals. And we're continuing our strategic planning process on Friday, gathering our staff and any Board of Health members that would like to attend. So we will continue that work. And then the next slide, we can we can pop through, there we go. I wanted to just give you a little update about COVID that I learned today. So we received an alert, or not an alert, they call it an alert, but it's not anything alarming. But an update from MDHHS today, just saying, you know, we're watching this BA2 variant, we're watching what's happening in the UK, and they're making some projections about where things might go. What they said basically kind of fell into 3 bullets. One is that they don't expect to see a sharp spike in cases that we did see in December, January with the Omicron variant, but they are expecting to see a slower rise. The cases might even double from where they are right now. Hospitalizations and mortality are not expected to increase in the same way. So that is really good news. You know, part of that is the level of vaccination and boosters that we have, that people have received throughout our communities. And part of it is the immunity from recent Omicron infections, and all of that just kind of works together to create a more protective environment. So while we do expect to see cases go up, we don't expect to see, you know, a huge spike in hospitalizations and mortality. And therefore, they're not expecting us to move from this recovery phase that we're in right now into either the response or preparedness phase, which would be where we would be, you know, stepping up mitigation measures. So I thought that was a relief to hear. We've certainly been watching that. And
Yeah, I have a question in regards to that. Are they calling this Omicron still, or is it developed a new name?
it's Omicron BA2.
Okay,
So
so
the-
it's a variant of
Mhm.
Omicron. And is it true every time a new variant comes along, it's a weaker strain?
Not necessarily.
But for the most part, that's what we've seen.
It has been the case with Delta was, you know, if, you know, there's a different ways that you would call it stronger or weaker. It might be more transmissible. It might cause more severe illness. Delta was both in both ways, more severe, I guess, than the variant before it, but Omicron was less. So
Thank you.
yeah, you bet. Yeah, the last one was Omicron BA1, and this is Omicron BA2. So anyway, I wanted to share those projections with you. This slide, whoops, if you could just flip back to that one, sorry, Laurel. If you could look at that, this slide is something that they shared with us along with the update. It's available on the MDHHS website. But the top one is just talking about the transmission rate of this particular variant. And so it's the dotted line way to the right is kind of the what if scenario. Right now, the transmission rate is at a level where we would expect it to kind of follow the pattern it followed in the UK. And so we would see that transmission rate continue to go up for a little while longer toward the end of April, and then start to decrease. And then cases in the bottom graph would follow that. But you can see, compared to that spike we saw in between January and February there, it's really a much, you know, smaller curve, not as high, not as sharp. So I just wanted to share that. And then there's just one final slide. And that's basically just, you know, I just want to thank you all for your support. I want to thank our Board of Health members, Will and Patricia. You know, you've been such a great support to our team. Thank you for, you know, engaging and learning and, you know, helping us along the way. And we have an amazing public health team here. Public health employees and public health workers have suffered through the pandemic, as have many people. But there, you know, there are a couple studies that concern me that just speak to the level of burnout and trauma that public health workers have experienced. So, you know, I'm concerned about our future workforce, and I think what we can all do is just help them to be resilient. And when we think about resilience, it really is all about trying to have hope for the future and trying to be optimistic and have a positive attitude. And, you know, so they're all really trying to do that, and they need all of you. So thank you. Thank you for your support.
Any questions? Go ahead.
This isn't a question, it's a comment, and that is to just thank you, Rita, for your outstanding leadership and for the incredible work that you and your amazing staff have done. Thank you very much. We wouldn't be this side of where we are of 2020 without you, needless to say, or even to have all the many other programs that you so creatively have brought into existence before. So
Thank you.
wanted to say thank you.
Thank you. I appreciate that.
I too would like to thank you for your service and your dedication to our health.
Thank you.
And I wish you the best as you recover yourself from a couple of very, very tough years. You served us impeccably, and I thank you. And good luck to you.
Thank you.
May something good come from this.
Thank you. Thank you.
I'd like to say the same thing. Thanks for your service. I've only worked with you for a year and a half, and I wish you the best of luck. And
Thank
whatever your next venture is, wish you the best.
Thank you. Thank you so much. It's been my honor to serve this health department and the people in Benzene and Leelanau County, and to be able to work with such an amazing staff. And I'm still a Leelanau County resident, so I hope to stay involved in some things.
I was wondering if you could speak to the therapeutics, the new one that they, for COVID, and how that's, developed over time.
Yeah.
I would appreciate
Sure,
that.
of
So
course. Yeah, I'd be happy to. So there are two basic kind of buckets of therapeutics. One is the monoclonal antibody treatment, which typically is administered either by injection or IV infusion, mostly being done in the hospital right now. And then there are the oral antivirals, which are the prescriptions that people can get from their doctor. Both are intended to prevent severe disease. So you don't, sometimes we hear, oh, my doctor told me not to get that because I am not sick enough. That's not really what we want to see happen. We want to see people get those therapeutics nice and early so that they don't get really sick. The oral antivirals are the most available right now. Paxlovid in particular is the one that's most available. Does have some risk for interactions with other drugs, so not everybody can take it. Certain underlying conditions could be a problem. So it certainly is something that needs to be, you need to see your doctor and get a prescription from your doctor for that. It has to be started within 5 days of your symptoms starting. So that's another tricky part of it. But then there are also the monoclonal antibody treatments. Unfortunately, the monoclonal antibody treatments have varied a little bit in their effectiveness against certain variants. And so there have been some, you've heard like, well, the CDC pulled this one off the market. Well, it was because it wasn't effective against the primary circulating variant. And so they held that back for, so as not to waste it, and it wouldn't necessarily be effective. And there is some hope for the newest one, the Evusheld is the one that actually helps people who can't make antibodies to the virus. So maybe somebody who's undergoing chemo or has an immunosuppressing condition, they're able to get injections of that medication to help them generate those antibodies. So, a lot of hope, but the tricky part about COVID is just the different variants that come and how things work with those new variants. So we have to deal with supply issues.
Yeah, I just thank you for that, because when we initially started, there was just no therapeutics at all.
Oh, my goodness, we have, so many more tools in our toolbox now than we had before.
Yes, thank you. Thank you very much, Lisa, for your service. I have a question on the staffing. So in Jody's department, two new additional employees that help with billing and services.
Part-time biller and an accountant.
Okay, so and then two new employees in the environmental health. Is that half-time employee also in environmental health?
Yes.
So basically three new employees this year. And then are they being paid for out of, you said growth, out of standard county budgeting, state funding, fees, or some of this COVID or grant dollars that we won't see again? How are those new positions being funded?
So environmental health typically is funded by environmental health funding. And so it's permit revenue, and the increased demand drives increased staffing to meet the demand. And then our backbone is spread across all programs. And so any source of funding that we have contributes to anything in Doty's
And I
division.
think you did mention grants, but so grants help overall, but you're positive that the general funding for the department will sustain those positions without.
Yeah.
Okay.
Yeah.
And my question was, what's your total count for employees now?
Oh, Jody, what is our total?
We're reaching, I think we have 47.
Okay. And because everybody else asked some of the questions I was going to ask and made comments, I also want to thank you for your service to the community.
Thank you. I appreciate that. Thank you.
Thank you very much.
All right.
Appreciate it.
Thank you.
For being-
You bet. Have a great night.
All right, so then that brings us to our consent agenda. And the purpose of the consent agenda is to expedite business by grouping non-controversial items together to be dealt with in one motion without discussion. Any commissioner may ask that an item on the consent agenda be removed and placed elsewhere on the agenda for full discussion. Such request will be automatically respected and will not need a second. Commissioner Wesson.
Move to approve the consent agenda as presented.
Second.
Well, I have a question. Don't necessarily want to pull off the mattress recycling, but do we have to have further discussion on that since we got an amendment? Trudy's probably not here. Is that?
So let's just pull it off.
All right, we'll pull off mattress recycling.
And we'll put that as 13C.
Okay.
Any other? All those in favor say aye.
Aye.
All those opposed, no. The motion passes 7-0. Thank you. So then that would bring us to action item number 7. We have-
I have copies of it. You asked for clean copies last week. Got to pass them out. So the language is the same as just a clean copy.
So there are any questions about this? Oops. Yeah, go ahead.
Well, I just asked my question ahead of time. So for every 2 years since '86, this millage has been approved in Leland County for the additional snow removal and maintenance of our county roads on top of all of your other funding. So this is the very same, this is the same amount as it has been for the last several years then?
Yeah, there's
To keep you whole with heavily rollback and all of that? By
Yeah,
having it every 2 years?
exactly. That's the thousands of a percent is but the heavy rollback, but spend $500,000 as prior to adjustments. Yep.
So we have a motion. Commissioner Walker.
I would move that Leland County Board of Commissioners approve resolution number 2022 whatever it shall be. Yes, for the approval of for the place on the ballot, the roads and highways maintenance and repair village renewal proposal. Support.
And this would be a roll call
Commissioner Lautner,
Yes.
Commissioner Robbins,
vote. Yes.
Commissioner Rushton,
Yes.
Commissioner Sotomayor,
Yes.
Commissioner Wessel,
Yes.
Commissioner Allgaier,
Yes.
Chairman Bonick,
Yes.
7-0.
Motion passes 7-0. Thank you
Thank you. Appreciate it.
for showing up.
Absolutely.
Really appreciate that. All right, and that brings us to the sheriff office approval of the port security grant application.
Good evening, everybody.
No,
Did you need me to explain it?
Been here all day. sorry.
Yeah, I think this will be the 14th time or 15th time I've explained it. Do you need anything explained on it as far as the need for the boat or the type boat or anything?
I would move that the Leelanau County Board of Commissioners approve the Sheriff's Office 2022 Port Security Grant application. County portion of funds to come from directions provided by the Leelanau County Board of Commissioners.
All those in favor say aye.
Aye.
All those opposed, no. Aye, I mean, no. So motion passes 6-1. Thank you very much.
I'll keep trying.
Let's hope this is good.
What's that?
Do we want to identify the source now, or do we do that later?
No, we'll do that later.
All right, thank you, everybody.
Thank you, Sheriff.
So then that would bring us to number 9, the Monica Valley parking lot entrance bid. Page 3. motion or do we move on? Commissioner Elder.
You don't want to approve this? No, I don't want to approve.
Oh, that's right, you did. I move that the Leelanau County Board of Commissioners approve entering into an agreement with Pop Excavating to construct a commercial drive entrance into Veronica Valley Park at a cost not to exceed $28,086.50. Funds to come from 101-850-756-77. 970. Pending council, has council reviewed this?
No, because you haven't approved it yet.
Okay, pending council review and approval.
Comments? Commissioner Rushton.
In the motion, it says it's a commercial drive. Well, I think we had somewhat of a conversation about this last week. No such thing as a commercial drive. No. Do our other parks have the same type of entrance to their parks? Or is this something that we're going to have to visit for every park?
Well, my comments were different, but I can probably answer as can Commissioner Robbins as we get to it. I think this one is opened up because we replaced the culvert at this park. So now since we replaced the culvert, it's created a situation that opened this can of worms, in my opinion, and now we have to repair it. The recommendation is to put a commercial drive entrance, which is curbs in there. So I imagine that as we go along, if our parks have similar situations, this is probably also going to be a recommendation. This recommendation did come out of Parks and Recreation where I opposed it, but at Parks and Recreation, we were told by a road commissioner representative that we had to do this. And while I questioned, he said it was because it was a park and it was basically a commercial entity. And I questioned that, and I was told that it was a commercial entity, we had to do the curbs. We since, Chet looked into this for me and he said, we do not have to do curbs. So Parks and Recreation was not aware of the fact that we don't have to do curbs. We do still have the issue. I drove very slowly up here today, so I could look at many very similar road entrances all the way up east side of the lake. And what I found is that many of them were exactly what I said we could do. There are driveways, steep lot, because what has happened now with this new culvert is it's eroded very poorly. And all we're doing is putting out cones instead of putting patch in there right now until we can figure this out. They're allowing it to just continue to erode and wash away. So there's a real situation there. But what has been done in the past in these situations before the county got so curb happy was rocks for stabilization and sodding. So if you look at a lot of the ditches all up and down the roads, it's heavy sod and that it stabilizes those banks, especially along the creek there. And that was my preference, that we stabilize these banks with more natural materials rather than spend this amount of money on curbs. Which brings me to the next part. We have, I believe, and I was going to check that, and I do apologize, but I believe our entire capital outlay budget for Parks and Recreation is $45,000. We haven't even opened our parks yet, and we're going to spend $28,000 on curbs for one park when I feel we could easily stabilize this on our own. So it distresses me that we're going to spend this much money on curbs for that park, and it's a passive park. That was my objection. Yes, I do understand. It did pass Parks and Rec, as I said, but with the understanding that we had to do it. And there we are here today. And if this is our wish to spend Parks and Recreation's over half of our budget on just this item, then so be it. Over half of our budget, so be it. But I will object to it.
To Mr. Rush's question, the other two parts are a whole different scenario. You have the one in Maple City that it's just, there's no, what's different between this one and the other two is you got streams, you got a stream there, you got, what do you call it, springs, there's a little water in ground. And the problem I see here, I don't want to spend money, but I also want to fix it right the first time. I don't want to spend, like Mr. Lautner says, oh, we could probably patch it up early, and we spend $5,000, but then 2 years from now, we're spending another $5,000. So I feel like we need to do it right, plus we need to set an example. We're the government, we're the county, and we got runoff there. And, we'd probably send Steve out and give somebody else a ticket. It was the same scenario, but it's private. We need to have the curbs there. I mean, we're hung up on this word commercial. I don't know who started that. We just need curbs there. So to direct the water runoff to where it's supposed to go so it doesn't wash out. So that's where I'm going. I don't want to spend the $25,000, but I don't see another way of fixing it other than putting a Band-Aid on like Commissioner Lautner wants, and we're back at it 5 years or 3 years.
What's across the road from the park, the entrance?
A lot of wetland.
It's swamp. So where does the runoff go?
Going.
Does it go in that direction across the road?
I don't know. It goes, it's all over. There's
So we should be having a conversation with you. Yes, go ahead, Commissioner.
Going to run right down the shoulder of the road into the creek to answer that question, but that's not what I'm going to hand up. I thought I made it quite clear. I do apologize. I did not ask for a Band-Aid fix. I said we could patch it now and stabilize it until we can get it repaired in such a way as to get rocks inside and, to stabilize. That would be the goal, to stabilize that bank, both banks on either side, without just running it further down the road.
Any other questions, statements? All those in favor say aye.
Aye.
All those opposed, no.
Aye.
Motion passes 6-1. And that brings us then to approval of the invoice for the fish for Untitled.
I move to approve the Leland County Board of Commissioners waive the policy on bid requirements and approve the purchase of fish from Legacy Fish Farms of Global, Michigan for Veronica Valley Ponds in an amount not to exceed $4,366. Funds to come from account number 727-000.
Support.
All those in favor say aye.
I have a question, if
Okay,
you don't
sorry.
mind. The fund that the money is coming from is whose fund?
Parks and
That's part of
Recreation
the
budget.
parks budget. And how many years have they been doing this?
Oh, I want to say more than 5. The kids
Oh,
fishing
10,
day is
probably.
huge. It's been a long
At
time.
least 10 to 12 years, I'd say.
I would guess, yeah, possibly.
And this is where the funds have always come from.
One thing I can say, the community certainly does enjoy that day. Even though I think $4,366 is a ridiculous price for fish,
And it's every year.
and it's every year.
It-
And I raised my voice against that several years ago, and the price just keeps going up. So anybody who wants to volunteer, put in a pond, raise some fish, and donate it to the county, we're open to that.
Any other questions? Yes, go ahead.
Just another statement. I don't have my paperwork from the meeting that day, but I know Legacy gave us a great deal on those fish. I believe we are the only public kids fishing pond or public kids fishing pond north of, I'm leaning heavily on Rick here, north of
Cincinnati,
Claire,
Ohio.
possibly Cincinnati, Ohio. I was thinking more like Grand Rapids. We're really pretty unique up here. So that is really feels deeply that they want to help us do that. So the fish really went out just a few cents a fish where they should have been probably raised more, in which case we are going to have a real problem. So it is a lot of money for fishes.
Well, you know, and I will say that it has been over 5,000, so it hasn't gone up. And actually, the Lake Association is pitching in some of the money this year to help keep the price down for us. So I mean, it's, but the DNR loves it. They think it's one of the premier fishing things in northern Michigan. And my grandkids use it.
But mine too.
Okay, now I'll ask all those in favor, say aye.
Aye.
All those opposed, no. Motion passes 7-0. Thank you. So then that brings us to the draft resolution concerning Michigan auto insurance reform.
And I thought that we would have a copy of that in our packets, but we did review it. We did have it last week. So I would.
No changes.
No, there were no changes. So I would make that motion that we approve and sign a resolution asking the legislature to act on auto insurance reform to support our citizens.
Could I just ask, is your motion to approve Leelanau County Resolution 20-22 urging state legislature to amend the Michigan Auto Insurance Reform Act to address a reimbursement cap for auto accident victims?
Thank you.
Is that what you were trying to say?
Yes, thank you. That's.
Commissioner Russell, second. So, did you have a speak?
I don't think I need to. I do want to support our residents.
Okay, because I did talk to the assistant of a representative who's on the insurance board at the state of Michigan. And that representative told me that he is getting lots of resolutions in. But they are not going to be in session probably till he said, yeah, almost probably not even in the lame duck session. So it might not be till after next year. Just so that it's not moving very, but they are getting plenty of resolutions for it.
And I couldn't find it, but I did notice that in the Mackinac Center update, which certainly is a very conservative organization, they had lots of concerns about the law and indicated that it needed to change. And I believe it does.
Any other questions?
Let's look for the resolution. All it asks is that they relook at it, correct?
Right.
Yes, okay.
So that would be a roll call.
Commissioner Allgaier,
Yes.
Chairman Bonnet,
Yes.
Commissioner Lautner,
Yes.
Commissioner Robbins,
Yes.
Commissioner Rushton,
Yes.
Commissioner Sorswell,
Yes.
Commissioner Wessel,
Yes.
7-0.
Thank you. And that brings us to the maintenance tractor proposal.
I think the only debate last week was whether we should trade it in or try to sell the tractor
Right.
independently. So we just forwarded to this week. So Jared's recommending that we trade the tractor.
Commissioner Elliott.
I would move that the Leelanau County Board of Commissioners approve the purchase of a 2022 Kubota M4D 071 HDC 12 with quoted attachments from Ginop Sales and Service of Williamsburg, Michigan, at a price not to exceed $37,689.62, which also includes trading in the 2008 Massey Ferguson. Funds to be 101-850-756-970-000 with a transfer from contingency or fund balance.
Second.
All those in favor say aye.
Aye.
All those opposed, no. Motion passes 7-0. Brings us to emergency management midway. Commissioner Wessel.
I move that the Leland County Board of Commissioners approve the agreement between the County of Leelanau and Midway Electronics Incorporated for the construction of a communications tower at the county government complex, an amount not to exceed $435,650, with payment as outlined in the agreement. Funds to come from Capital Tower Fund number 468-000-000-970.000. The chairman is authorized to sign said agreement.
Second.
Any questions for state about this?
Well, as we mentioned today, the contract has been signed by the company, so it's good news.
All those in favor say aye.
Aye.
All those opposed, no. Motion passes 7-0. Thank you. Now we'll move on to administration and the board goals.
Yeah, just, I thought this board did a great job this winter of passing goals for 2022 and quickly review them because actually I think we are making progress. So goal 1 was personnel and you had 3 sub goals under personnel. 1 was successfully conducted search for new administrator, and you know from this afternoon you're on your way doing that. So I think that's in progress. 1 we have not talked about, which sort of good at any point, the potential reorganization of the Leland Dam Authority, Department of Public Works. You do have the legal authority to do that. You talk about restructuring it. It's been members of the road commission. And I know in the past, some of them did not know they were on it after they got elected to office. And it really is up to this board how you wish to proceed with that. So I don't know if you want to put that on the agenda for May, to have a dialogue about that. And I can bring back the legal opinion from last time that you looked at this. Now, last time you said you thought it made sense, but you were switching from 3 to 5 road commission members. And you said, well, let's get through that transition. So that was a year and a half ago. So you're going through that process. So if there's interest, I can put it on the agenda for May if you wish to discuss it at this point. If you don't, that's fine too.
I think we said we want to talk about it, and I would like to do that, and I would suggest that we invite the Dam Authority to come to the meeting to talk with us about it.
But the Dam Authority members will invite the DPW, Public Works also, because they're both linked together. So yes, I'd be glad to do that if you wish to have it on there. Is everyone in agreement? We should have a dialogue on it. So on the agenda. They're both.
Oh, yeah.
Yeah, they're both.
I know they're the same.
Yeah. So that was my example, a little bit of humor there. All right, so I'll put it on the agenda as a dialogue, and I'll get that past legal opinion, but basically it's your decision. I believe the only mandated member is Steve Cushing. Explore the possibility of creating a facility management. We kind of did it with a study, and I thought we talked about during the budget process.
With that said, will the facilities manager have a role in the Leland Dam Authority? And that's what I was wondering. I guess I'm kind of wondering if it's, we're a little bit premature revamping the Leland Dam Authority at this time until we decide. Or
well, I'm assuming an employee cannot serve on the board. He or she
would be
the person responsible for it.
Okay.
So that's the
defining roles.
Yes.
Is what you're saying.
Yeah,
okay.
We're talking about a board versus an employee.
Board is mandated, correct?
Well, I would say sort of like Jerry does with the Park and Rec.
Yes.
He usually is the implementer.
But they're not voting members.
Yeah.
Yeah.
But I think the budget time would be a good time. I think last year we all kind of agreed we'd look at this. So
do we want to look at both Public Works and the dam at the same time, or just do one at a time?
I think that's the same.
Well, same members.
They're the same members, but they don't have to be the same makeup.
Yes.
Right. I think we should at least have a conversation about both of them overall. I don't know if it's a good idea to be calling them in to see if we want to separate that. Why don't you let us meet first and then have a meeting with everyone?
I'll get the original legal opinion that was drafted several years ago. It really is up to the board, though. The only state mandate is that joint commissioners.
would like to hear what he has to say as well.
Yeah, he has some opinions there.
Mhm.
Okay, goal number 2, consider the options for the use of the jail facility. I don't think we have done that, and we had a dialogue on that. And office space for the health department, which we talked about this morning. The sheriff's not here anymore, but I don't know, he has some strong feelings about the jail space. So I don't know if you want to have a dialogue on that or not.
So this is the time to talk about it.
Yeah.
Well, I did,
That's not fair.
Well, he did talk today about Kalkaska actually might be bringing a lot of prisoners over here.
yeah, I heard as many as 20.
Yeah,
Yeah, Kalkaska had 3 correction officers quit yesterday, and so they got 35 inmates are going to house out. 20 is coming over here is what I heard.
Well, I just feel like personally, we should always be looking out for what we can do over there to improve revenues and keep our minds open on it. So I think we should always, if we have an opportunity to talk about it, we should.
If you like, I can simply invite the sheriff and May to have a dialogue on it.
that'd be, I think so.
Keep that
Because
simple.
I know he is concerned about the gym just being empty all the time.
Early, we're making progress on.
Chairman, put his new vote in.
That would be expensive storage too. Thank you for that. Then anything else on the goals? Anything else? So then I would bring us to the finance director update.
And I'm just following up with the email that I sent out yesterday to all of you. As you know, Jen Zawicki has resigned her position effective Friday, and I want to thank her for 3 months of service. It just was not a fit, and I respect her decision to move on. And so I was trying to find an interim one, but I had identified a couple candidates, but for various reasons that didn't work out. So on a short-term basis, Darcy Weaver has accepted the challenge to be our interim finance director as of Monday. This does not interfere with our long-term goal of being the human resources director, that she has accepted that. But the salaries are the same currently and so forth. So on an interim basis, she will be getting duties Monday as finance director. I'm hoping to post the job and get qualified candidates. The job was posted last year. The biggest reason why we did not get any external candidates is the salaries. Upon Jen's resignation, I reached out to several counties. I reached out to our auditors and so forth, and people that I respect. And the biggest reason is the salary. If you want someone to be a finance director, the salary in below 60 is just not compatible to the market out there. So if you look at my recommendation, if you look at the non-salary, non-union pay scale, which is attached to the memo I sent out to you yesterday, I think a fair salary would be put it at the range of the clerk and the treasurer, which is a range of 69,108 to 75,701.
So, you saying. Do you think you could get somebody with that? Did you get a sense that people would hire?
It'd be in the range. We do, it's a little lower, but we do offer a great benefit package that other employers do not. Just like when we posted the IT, I was concerned about that. Our salary was lower, but we have insurance and we have defined benefit and virtually no chance of layoff.
You know, one of my concerns is if we are going to do this, we need to look. There are other positions in the county.
Well,
that need to be-
we actually have our meeting tomorrow on that. The committee's meeting tomorrow morning, but I picked this out of respect to the treasurer and the clerk also. So this pay scale would coincide with those positions.
I don't think it's unreasonable.
So do you think the IT director, that salary, or planning director would be sufficient?
I don't think so. We're looking for some very technical skills and very limited number of people that could do this job. And it's still gonna be low, but I'm hoping that what our benefit package and the ability to work long-term here and get a pension will be a drawing card. I had people call last time until they saw the salary.
Right.
We sort of can try and see where we are. But I'd like to get the job posted sooner than later, and obviously the biggest issue is going to be salary.
Well, you know, when Lisa was here, you know, the health director, they, and this is just for the finance department, when you look at the wages, they have a scale for every, you know, then they take every job, they have the different criterias, you know, whether it's a bachelor's or whatever, and they give points to each one of those things that it has, and then that's what they plug in, whatever that person, however they meet that criteria, that's their pay scale. And that would make it even all the way across. I mean, you might look at that, maybe talk to Doty and get that scale that they use, but probably won't apply because I'm sure it's medical.
We do have a committee meeting tomorrow morning with 3 commissioners on it. Anytime you look at salaries, it's very controversial. Everyone in theory always says, let's do salary study until the results come out, and very few times are they implemented because it's so controversial.
Yeah, well, then I'm saying, but if we had. this
Yeah, but that's,
criteria,
yeah, I'm stunned.
It's non-counting.
But to get the thing, I just felt out of respect to the treasurer and the clerk, I could not recommend the salary higher than those positions. So I'm keeping it that.
Commissioner Long.
I appreciate that. And I think, was it Will, did you just now mentioned, I got a question first. Building, how does the building official, I guess I'm trying to remember how the building official ended up at 69. Because that one seems to be, my only concern is, because we do have 3 elected officials, these are elected positions, and heads of departments. So as a finance director, should that fall more into one of our director
I think
ranges? So that's what.
on the bill officials, remember, we and a lot of counties were struggling finding people.
Yeah, so
I mean,
that's a
it's
skill.
market driven.
So that's the same as what happened with our equalization.
If you look at
department,
equalization,
basically.
yes.
Yes, okay. But I do like the idea of more like where our planning director is. I think that's a pretty good range. I mean, I'm not gonna fight this, but I kind of do like that so that it's in a range very close. It's within $1,500, but yet it's not up where our elected officials are.
I understand the administrator's argument. I worry about leaving some others behind. And I look at senior services, and I look at the planning director, and I look at the IT director, and before long, we're going to be hearing that there's another group of people that believe that they need an adjustment. And I sure wish we could save this until we have the discussion of all of the pending issues on it, so that we have one package. Otherwise, I mean, it was a year ago that we brought the assistant prosecutor in here, and it seems like we've been looking at these ever since. And I'd rather do it all at once.
The challenge we wait is, as a Monday, we don't have a finance director. Other than that's a unique situation. And by the time we post it and go through a process, it's going to take us a while. And that's a critical position. The other ones are people that are here, you know, and we'll treat everyone equally. You're right. We did start the process. We have a meeting tomorrow morning, which you'll get a legal opinion on some stuff we have to change. Talk about that tomorrow.
I'll put it out there. So I'll make a motion that we move the salary we're offering for our new finance director to the same as the our planning director. It starts at 67,572.
So as listed on the sheet.
as listed on this sheet, yes. It's a range of 67,572 to 74,821.
I'll support. 74,821.
Yeah.
Comments? Questions? Commissioner Sotomayor?
Well, the only question is what our current finance director continue for just a couple of months while we sort this through.
Well, she starts a new job Monday as the chief deputy clerk. She accepted the offer to go for the chief deputy clerk position.
Any other comments? Okay, all those in favor say aye.
Aye.
All those opposed, no. Motion passes 7-0.
Thank you.
My only comment is this process has not been handled well from start to finish. We've been very unprofessional the whole way,
Who has been?
and I regret that.
Any other comments? Thank you. All right, then that brings us to a review of financials.
No,
We
see.
have the.
Oh, I'm sorry. I'm sorry.
Consensus.
Was it the mattress?
Yeah.
Or the cot?
Yes, there's a mattress. I was just wondering if, because I was not here to hear the dialogue last week, Judy sent us a revision to the agreement, which the parties further understand and agree the county shall pay it, and the contractor shall receive $15 per mattress collected in excess of 100 mattresses initially contemplated in attachment A. So does that change anything? I was trying to dig through your motion last week. If we accept this, does a new revision just roll? Is
Yeah,
that
it'll be part of the
understanding?
contract. There's a change there. Trudy
Okay.
says it's fairly minor. It doesn't really change the service.
Okay.
Well, and the extra money would come out of the recycling budget.
Well, or it would be paid for by, well, yeah, it probably is. We're gonna pay a portion and then the citizens will pay,
right.
residents pay the rest. Okay, so as long as it doesn't change, I just want to make sure
No.
that we don't have to change anything because of her revision. I couldn't find the
Motion.
original presentation. So I can probably make a motion. I found it in the,
Chairman, there isn't a motion in the minutes because it was just to move it forward.
There was a
It does
motion there
move it
too.
forward.
So just include the whole contract.
Well, what did she have in her packet last week? Because this is just are we looking to just make the agreement with, Sparta, Bay Area Recycling for Charities, right? Or not, we've already accepted the grant from the Tribe to Help. That's already been done?
Yes.
Okay, so then I would move that the Leelanau County Board of Commissioners accept the mattress recycle agreement with or approve it with the Bay Area Recycling for Charities as revised.
All those in favor say
Well, I
aye.
may ask the clerk, do you think that's?
If it's okay, I'll be.
The,
dollar amount that you put in.
Well, the contract was in the board packet last week.
Yeah.
So this would just be incorporated into the final version.
And as I noticed here, the fee is the same. 24.70, is that correct for this week?
And then I think it's $15 mattress for anything over, that must have been for like 100 mattresses or something. And then we'll pay $15 over that, is that how I understood? Which is, it's a collection for 100 mattresses.
Right, that's the way.
And if we go over 100, we pay $15.
Yes.
So she gave it to us by resolution last week. Well, do we approve this by resolution or just an agreement? Okay. So to approve the agreement as presented and include along with the revised amendment.
I'm sure Trudy will revise it before our chairman signs it.
Okay.
Any other comments? Do you have that? Is that clear?
I understand, and as long as I don't change the meeting, I'll clean it up for you.
Okay.
Any other comments?
Is that a true statement? Is that the way you understand it? The,
That you're approving the agreement with the area recycling for charities park regarding mattress recycling
for the.
as revised.
As revised.
As revised, okay.
Okay, perfect.
Anything else? All those in favor say aye.
Aye.
All those opposed, no. Motion passes 7-0. And that brings us to the review of financials.
Jen answered all of my questions in between meetings today. So I have no, I have no further.
Any committee reports, recommendations, or resolutions?
I just have a public service announcement in regards to the- just get that. I'm not sure if anyone is aware, but the commander of the Coast Guard, the 9th Coast Guard District, is going to retire, and all of my fellow commissioners and associates have been invited to attend the change of command ceremony that will take place on June 11th at the Coast Guard Station. Command will transfer from Christopher L. Wright to Commander Andrew G. Shano, I believe is how you say it. And there will be a reception that follows 11 a.m. Friday, June 17th. RSVP is required. I'll send you the link. I'll send it to Chad.
I think we all
I
got.
think every commissioner. got
Oh,
it.
okay, good.
I would, if you haven't been there, it is a very moving ceremony, so if you could do it, you will be glad that you spent the time there.
I just saw this.
I think everyone got the email. If you didn't, let us know. But I think you all received.
I was asked to send, so I wasn't sure you had it, so great.
At the airport.
Any special reports? Commissioners, no. That brings us to public comment. Please come forward.
I want to thank each of the commissioners tonight for passing the resolution on auto insurance reform. A woman was here maybe a week ago, and talked about her individual case, her husband, who suffered a catastrophic auto accident and the deficit in scope of coverage with the current insurance we have on board with the state. I would recommend to each of you, as a healthcare professional, I was involved in healthcare administration for almost 50 years and intimately involved in auto insurance at the beginning, at the end of my career. Again, I would suggest to you and the public, seek out your auto insurance carrier, talk to them about your scope of coverage. Some people will tell you there are tiers of coverage. You're going to save $1, maybe $500 if you select the lower tier of coverage. And the problem with that is if you have an auto accident, the injuries, the medical services you need will not be covered by Medicare or your individual healthcare carrier. There's going to be subrogation, and it's going to fall back on you if you don't have the opportunity to elect a higher tier of coverage. So again, get an opinion from your current carrier, a second opinion. And if you have the money, take the highest scope of coverage you can for healthcare. One day, one service can exceed the $500 savings you think you're going to get at the beginning. The reform we're talking about is years, if not decades away. The Republicans in Whitmer passed a flawed bill. It is a major takeaway for many, many services. Thank you.
Thank you. Any other public comment? Seeing none, we'll move on to approval of financials. You have amendments? Commissioner Watt.
Oh, if I may, just under Commissioner comments.
Oh, I'm sorry. Yeah.
Yes, okay. I just want to apologize for being gone last week. Thank you for holding down the boat while I was gone. I attended a fantastic conference and learned a lot. Regrettably, it felt over executive, but hopefully in the future I can share many of the things that I learned there. So thank you for that.
Any other commissioner comments?
Yes. I'm still troubled by we're experiencing right now the ramifications of a hasty decision to create an HR and finance positions without any study, discussion, planning. It just happened. I regret that one of our very good, smart, loyal employees suffered because of that. It's very reasonable when you get into a job and find out it's a whole lot bigger, that you draw a line and say, no, I'm not getting paid for that. But that should never have happened. And I think it's because we went into this whole change with so little thought and planning. And so I hope we will learn from this. And in the future, we'll take more care with our employees, with our plans, with our budget, which is paid for by our people. I just hope we learn from this. Thank you for your service.
I couldn't say it any better than Commissioner Algar just said, but I will add, thank you. You are an incredibly skilled, amazing woman who I don't think I've ever seen anyone with command of this subject material that you have, and thank you.
Anyone else? All right, we'll move on to approval of financials. We have amendments and transfers. Commissioner Watt.
Yes, I would move that we approve fund transfer number 22-002.
All those in favor say aye.
Aye.
All those opposed, no. Motion passes 7-0.
I move we approve amendment number 22-003, 004, and 005.
Support. All those in favor say aye.
Aye.
All those opposed, no. Passes 7-0.
Move we approve claims and accounts $263,847.87. Support.
All those in favor say aye.
Aye.
All those opposed, no. Motion passes 7-0. Post audit.
Approve post audit $2,615,168.44. Support.
All those in favor say aye.
Aye.
All those opposed, no. Motion passes 7-0. We are adjourned.